All right, so we're here at Aberdeen High School at the local school fair, and we're going to be talking a little bit about congestive heart failure. So what is congestive heart failure? So congestive heart failure is a complex syndrome resulting from functional or structural impairment of ventricular filling or ejection of blood into the circulation. It may result from disorders of the pericardium, myocardium, endocardium, cardiac valves, or great vessels, or from metabolic abnormalities. So after that huge long description, you're probably still thinking, okay, what is congestive heart failure? Because that probably didn't make any sense at all. Basically, in short terms, congestive heart failure is exhaustion of the heart after having to pump an excessive amount of blood for a long period of time. This can occur in all parts of the heart, so the atriums, the ventricles, within the walls themselves, and it's a very serious condition. The inability of the heart to pump adequately leads to decreased oxygen reaching its destination. This is a problem because your body needs oxygen. If your body's not getting the oxygen, it starts to get fatigued, breaks down, and cells and tissues and muscle can die. Heart failure is commonly categorized as either left or right-sided heart failure. Both are heart failures and both are bad. However, the signs and symptoms of each one are completely different. So if you have right-sided heart failure, you're going to see symptoms that go along with the backing up of fluid trying to get into the heart itself. So generalized edema through the whole body, or basically you get puffy skin at your ankles, your arms. You can also see one of the other things that you can see is a distended neck vein. So basically the fluid is building up so much that you can see your pulse and see your veins bulging at your neck. With left-sided heart failure, the congestion is more within the chest. So you see a lot of pulmonary issues. So cough, problems laying down. You can even see, you can hear crackles and wheezes in your lungs, and even see blood-tinged sputum or mucus come up from your lungs when you cough. This is an example of what a normal, healthy heart would look like compared to someone with congestive heart failure. If you can notice right here that the myocardial, or the wall of the heart, is a lot thinner and the space is a lot bigger. This is because there's so much fluid coming into the heart, and the heart's trying to contract so much that it's starting to kind of stretch out, and it can wear down the walls of the heart. This is what occurs in congestive heart failure. Primary causes, there's many things that can cause congestive heart failure, but the two main ones is hypertension over a long period of time, so high blood pressure, and coronary artery disease. This is including heart attacks, atherosclerosis, so basically plaque starts to build up on the inside of the walls of your arteries and makes it hard for blood to pump to where it needs to go. Risk factors, if you're diabetic, if you're obese, and if you don't exercise regularly, or if you have a sedentary lifestyle, these are all risk factors that put you at risk for congestive heart failure. How often it happens and the statistics of it is actually kind of shocking. So 5.8 million Americans suffer from congestive heart failure. 1 in 5 people will develop heart failure. You can see this cute little diagram of people holding hands. Unfortunately, he drew the short stick and he had congestive heart failure. It really sucks. And 1 in 4 deaths will contribute from heart failure. The mortality rate of heart failure depends on when you detect it. So lots of times, once the diagnosis has been made, the survival rate is between 50% and 5 years. How does this affect the patient himself and the families? Because there's so much exertion going on the heart trying to get the O2 to the rest of the body, there's many activities that are limited. So they're short of breath a lot of the time. Normal activities like walking, hiking, going upstairs are very limited. The income of the patients and families might be limited as well due to the expense transplants that are needed in order to take care of someone with congestive heart failure. Even stresses themselves on a normal daily life, worsen the symptoms of congestive heart failure, which is also not very good. Some of the things that might influence the disease factors or make the conditions better or worse: financial instability. So if you are unable to pay for the medication or the treatments needed, that may be a hindering aspect with someone with congestive heart failure. Non-compliance, which is actually one of the main ones that we tend to see in patients, is basically you don't follow the regimen that you're supposed to be following. You skip doses, or you don't take doses, or you just ignore it completely, which then allows for congestive heart failure to get worse, and then the end result is not very good. Distance to the nearest facility, depending on how close you are to treatment and how far you are from treatment, is also a hindering factor in getting the adequate care needed. Especially since here in Aberdeen, since you have to drive so far away to the nearest hospital, I mean, it could also, if you don't have a car, you don't have the financial ability to get to the nearest hospital, it can be very difficult. Some of the things that you can do to prevent congestive heart failure: maintain a healthy weight, proper exercise, treat high blood pressure, control diabetes, manage lipids, and eating healthy. Long story short, eat healthy, exercise, treat your heart good. These are all things that can prevent and help manage signs and symptoms of congestive heart failure. If you don't, your next options are heart transplant. Sorry, I kind of cut the screen off a little bit. But a heart transplant or digoxin therapy, along with a ton of other medications for the rest of your life. So it'd be much wiser now to just take care of it and manage it, and treat your body good, than have to go through something like a heart transplant or medication therapy. And kind of just going along with the care plan, like what is the most important thing that we can do? Manage current symptoms and prevent further symptoms of heart failure. These are the two main things that we can do, like I just said, to take care of congestive heart failure and prevent it completely. We have also, if you guys would like, I would be willing to, if you guys can write down your emails, I'd love to send you guys this PowerPoint so you guys can look at this and read it further in depth. There's just kind of bolded parts that I wanted to cover for you guys, the important topics. But there's a lot more information here for you guys to learn and read about, for not only you if you have congestive heart failure, but also for family members and loved ones who have congestive heart failure. Is there any questions that you guys have? No. Well, thank you for your time.
I can't write. Do you have a brochure that I can have?
I can't write down my email because